Hello, everyone. I am Dr. Sri Banerjee, core faculty for College of Health Professions, and it is with great honor that I am presenting the stroke as an antecedent risk factor for depression among postmenopausal women at the European Union Public Health Association for 2021. Myself, along with um, John Hute and Dr. Gary Burkholder from um, the School of Psychology, we presented and worked on this topic. This is a very important topic, especially when we're thinking about women after menopause, due to the fact that the body becomes more susceptible to clots. So I'm going to be talking a little bit more about why it was specifically important for us to try and understand this problem among postmenopausal women. So today I'll be going over within this talk about the stroke, importance of stroke, and surveillance systems being set up, trying to monitor additional diseases that may develop after a person has experienced a stroke. Additionally, analyzing nationally representative data sets, how to do so, I'll show you specifically here. And then understanding that connection between physical and mental health is very important. But before we do any of that, let's start with the basics and start by thinking about how the pathophysiology works within the body. So taking a look at how the heart and the brain are connected, if we first start off with the heart and the circulation that is coming out of the heart and then connecting to the brain. And if we draw the brain here, here's the brain stem. So the circulation from the heart to the brain, on in very simple terms, needs to be intact. Now, what happens is plaques build up. With time, plaques start to build up within the coronary arteries. They start to uh, build up in terms of the carotid arteries. So, um, in terms of the brachiocephalic artery, this branches off of the aorta in from the heart, and then the brachiocephalic branches out and then supplies blood to the arm axilla area, and then also the brachial area, and also the cephalic area, which is the head. So the common carotid then gives rise to the internal carotid and then branches off and gives rise to the middle cerebral artery within the brain. So here within this picture to the left, you can see how the internal carotid enters the brain and then joins up with circulation, and so this is the middle cerebral artery. So these bifurcations that are in here, these are the areas where clots form and get lodged. So there are two types of stroke: ischemic stroke and hemorrhagic stroke. So the ischemic stroke is what we're talking about here. And what happens if the clot gets lodged in a specific area, then this starts to cause problems and lack of oxygen ensues. So I'm going to exit drawing here. So the World Health Organization at the same time declared depression as a leading cause of disability worldwide. So let's take a look at what we already know about stroke and depression and about post-stroke depression, which has been already characterized. So as many as 1 out of 3 individuals develop depression after stroke. This is a known fact, and there's numerous studies that show a link. There's risk factors and characteristics of stroke which are important to understand. We already know a lot of the risk factors. This has been studied for a long time, but specifically, how is it different in women than men? How does the postmenopausal state in the body make it more more fertile ground for formation of clots? So post-stroke depression has been studied for nearly 100 years, but in the 1980s, there were longitudinal studies that were conducted by Sir Martin Roth and others, who was considered the father of neuropsychopharmacology. And so, just understanding that connection in a nationally representative data set, this hadn't been actually done in the past. So this is what we were looking at currently. If you look at the DSM criteria and the DSM-5 criteria, there needs to be a presence of five of these in order to specifically diagnose somebody with uh, post-stroke depression. But that was not what was used as a diagnostic criteria from our study. And this was because this was not a case definition that we could employ. Other meta-analyses have been conducted in the past and have shown increased mortality for post-stroke depression, longer term disability, and even people have seen suicidal ideation. So the problem statement for us was, even though there is a development of depression after stroke, most of the times this depression goes undiagnosed, and there's several reasons for this. But the main reason is because some of the symptoms are not, the patient doesn't really recognize it many times due to other symptoms. So it's up to the caregivers a lot of times to be able to find those telltale signs of depression in an individual that has experienced stroke. So here's a patient health questionnaire 9, which was the depression questionnaire scale that was used, and it's really important scale because it's especially when we're talking about stroke and heart disease, the types of mental disorders that are subsequent to that, those are hard to identify, and so PHQ-9 can do so. So in our specific study, anybody who had on that PHQ-9 over greater than or equal to 10 were positive for depression. And again, we used the National Health and Nutrition Examination Survey for this study between the years 2005, 2010, and individuals were considered positive for stroke if they told the researchers, if they had told that they had a stroke. And then, of course, logistic regression was used to look for associations. So ethnicity distribution, this was reflective of the general population. And of course, because of complex samples, any sort of adjustment was made if there was an over or underrepresentation of a certain group in the population. So in conclusion, um, from the study, from our study, we were able to find significant association between previous stroke and current depression. And so this was extremely important. So let's go through the results of the study. So out of 3,636 postmenopausal women, the mean age was 62.6. So this was representative of approximately 44 million individuals within the United States. Um, Also, we found that the history of stroke, individuals with a history of stroke had a 2.5 times higher odds of active depression than those without a history of stroke. Now, when controlling for vascular risk factors, so the expectation would be that, there would be some attenuation, and we did indeed see some attenuation, but still the odds ratio remained 2.2, and which is just as strong as the initial odds ratio from the age-adjusted analysis. So again, going back to that conclusion, I think it's important to note that there is, again, in this study as well as previously has been found, that uh, the depression does result from previous stroke history. Now, in terms of how that is strengthened in postmenopausal women, that was unique to this study, and we found that this was specifically strong um, in this population. So it's really important to be observant and to notice signs, telltale signs of depression, especially in individuals that have experienced a stroke in the past. And surveillance efforts need to keep addressing preventative measures of mental health in individuals that have experienced stroke. Thank you for listening.